Hi, everyone. My name is Dana Abramovitz, and I am a lead advisor with Seven Investing. I am joined today with Amanda Epp, founding team member and CEO of ScriptDrop. We're going to talk about, telehealth and technology in healthcare, and all sorts of things. So I'm excited to welcome Amanda. Thank you for joining me today.
Thanks for having me.
Cool. All right. So ScriptDrop is a relatively new company. Can you tell us more about it and, why you found a need to create it now?
Yeah, so we are relatively new, and of course, our growth accelerated last year, probably light years beyond what we thought we would do at this point. But really, we exist because everything can go right in a patient journey, right? So a script is written for a medication for a patient. There's a lot of time, energy, and effort too that goes on behind the scenes, often that patients don't know about, to gain access to that medication for the patient. And then the pharmacist has to do a lot of work in order to just even dispense it. And over 25% of the time, the patient actually doesn't do their part to pick it up. And it is usually a $0 copay or maybe under $10. So it might not always be a financial reason. It often is critical that they get on that therapy, and still it's abandoned. So that's really why ScriptDrop exists and was created, is because we needed a way to make medication access just more convenient for patients, because we know healthy outcomes start at home first and foremost. So we've built out our network over the years to ensure that no matter where you're at as a patient, no matter what state, that you're able to connect to prescription delivery through us.
That is amazing. I hadn't thought about patients not picking up their prescriptions, and that being a problem. I mean, I know all sorts of patients' complications during the healthcare journey. Just making appointments on time, following up. But I didn't realize that picking up the prescription was such a big problem.
Yeah, or even just time to get on therapy too. When you think of leaving your doctor's office and you prescribe something and you're like, yeah, I'll make it to the pharmacy at some point, or I'll go through the drive-through, and still life gets in the way, and it could be days before you get on a medication that you should be taking right away. Or even when you think about some medications, you don't feel the impact of them as much. And so you think as a patient, oh, I'm okay, I don't need to take it. So you delay that getting to the pharmacy even more. So being able to just connect patients with a different way to get prescriptions, instead of actually having to do their part to just get to the pharmacy, that's where we take over and really provide that convenience.
Excellent. Yeah. And then you mentioned, just your accelerated growth during the past year during the pandemic. I'd love to hear more about that. I'm actually going to change the view so that we're gallery view. There we go. We'll see if that helps. Okay.
Yeah. So in all of 2020, our partnerships grew actually 220%. A lot of, pharmacies and retailers, of course, had to change their way of thinking. Usually it was, oh, I want foot traffic, and a pharmacy is a way to drive that foot traffic into the store and increase basket size. Well, patients weren't safe going into the store. So our partnerships definitely accelerated. Our revenue grew over 170% over 2019, and then our volume increased over 320%. So a really big year, a lot for us to keep up with, but it was it was still an exciting journey, knowing that we were making such an impact in a critical time and critical need for patients.
Yeah, and so you touched upon your partnerships. Do you want to expand on that? Like how does that work, and how are you helping them, and how just that symbiotic relationship?
Yeah, so some of our partnerships, actually the beauty of ScriptDrop is our product sort of plugs into that healthcare ecosystem and creates a win-win-win for all the different parties involved. I mean, everybody cares about making sure that the patient is on therapy. We lower readmittance rates back into the hospital, and they become healthier. That's what's really best for healthcare outcomes as a whole, and where, our healthcare needs to head is that patient-based outcomes, understanding that, patients are getting healthier from the medications. And so we really started with our pharmacy partners. Delivery is not new to them. There's independent pharmacies and even retail chains out there that are offering delivery before ScriptDrop, and even mail order. But what we knew about pharmacies is that the more and more you can reduce their administrative burden, the more that they will use it, and the more patients then are becoming healthier. So really that was the first place that we approached, is integrating directly into the pharmacy systems, and being a part of the pharmacist workflow, whether it's in their patient apps that they're creating or their actual pharmacy workflow. We plug in either way to give them a more convenient and easy and seamless way to offer delivery for their patients. So we work with chains like Rite Aid, Publix, Albertsons, companies. And then we've also worked with health systems over the years too. So when you think about it, health systems, of course, want to make sure that their patients are staying healthy and they're lowering their readmittance rates back into the hospitals. So we work with health systems, as well as now where we are starting to pilot some programs too, is payers, pharmaceutical manufacturers, telehealth companies, because everybody, of course, wants that patient to stay healthy, but they need that last mile delivery to know that that patient is actually on therapy, and we can continue to power the refills from there.
That's wonderful. You mentioned two things that I really like talking about. So value-based care, and making sure that the patient gets what they need, and really focusing and emphasizing the patient, but then also the ecosystem, and not just applying technology as a Band-Aid to the healthcare system. So many technology companies are just like, oh, this healthcare system, it's broken. If we just add this technology to it, it'll be so much easier, so much better. But it sounds like you really took the time to understand the ecosystem, and understood like what are the needs, the limitations of the pharmacists, so that you could work with them to improve their existing workflows rather than just sticking a Band-Aid on top of it.
You are so right. And there's so many times tech companies come in and it's like, here's a Band-Aid here, and then something else breaks, and then it's another company that goes in to fix it. And yeah, exactly. And that's the approach we want to take, is look at it all holistically. And we believe in healthcare. It's not about disrupting. It's about partnering. There are so many problems in healthcare that technology helps to solve, or when you look at it big picture, or you put pieces and parts of companies together, that's really when you can make a big impact. So we do take the approach of we're a partner, we're not a competitor. That's why we plug into so many different areas in the healthcare ecosystem and that patient journey, because at the end of the day, what matters most to all of those people is that the patient stays healthy, and back to outcomes-based care.
Yeah, I love that. I love that. All right, so we've talked about how you guys are fitting into the larger market. It sounds like there's been a lot of growth, and I know we were chatting earlier about your team, and how when I first looked at your website, it was great to see like all these women leaders on your team, and just how your team is growing and integrating into the market.
Yes. So we do have a lot of women in leadership, and what I think we're starting to see more of, which is exciting, is more CEOs and presidents of these larger healthcare companies too. When you look at even CVS and Walgreens, and it's really exciting to see women at the forefront. And really that's ScriptDrop too. We actually have a lot of women in leadership, and are excited about, actually going to a meeting, and we had a team of all women on a project that I was just shocked. We didn't mean for that to happen. And it was a full group of women leading this project together. Or nowadays, I'm starting to hear in either investor meetings or even in just actually pharmacy technology meetings, they're all women sometimes. And it's interesting that we all have to make a comment about it. Like, hey,
Sure.
I'm never in a meeting where it's all women,
Yeah.
but I'm hearing it more and more. And I think some of it is because we have empowered so many women leaders at ScriptDrop that we're just naturally a part of more meetings with all women. But also, it hopefully we won't have to comment that it's unusual in the near future.
No, I think we are getting there, which is great.
We are, yes.
Yeah. So how does ScriptDrop like fit into the larger telehealth component? So if somebody's using a telehealth has a telehealth visit with their doctor, how do you plug into that?
Yes, so I'm excited. We should have we have a telehealth partnership live, and we're looking to launch a really big one here in the near future. But when you think about it, if you're getting a virtual visit, you shouldn't be going to the pharmacy then to get your medication. So it makes sense to get that prescription delivered. So ScriptDrop is plugging into that telehealth visit to ensure that at the point of the doctor prescribing the medication, that delivery is an option. And delivery can be an option from your preferred pharmacy. And we can work with you to ensure that that prescription gets delivered. So it's a different approach, and it's utilizing the way that we have built our platform. So we often get compared to logistics companies. And logistics companies, though, they care about volume and density and taking things from point A to point B. And our approach has always been, we care about the patient. So we're going to take on the rural areas. We're going to take on the places that, your logistics companies really don't want to go, because we care about getting that patient maybe 20 miles away from the pharmacy on their medication. So because we've made deliveries in all 50 states, because we've taken that approach, it's much easier for a telehealth provider to plug ScriptDrop into that platform, because we don't have any limitations on where we really can go for that patient. It's just, do you want delivery? And we can take care of it.
I love that. And again, I love that you're focusing on the patient and, making sure that they get the care that they need, and everything else just kind of, you make it work.
Right. If you focus on the patient first, everybody else wins, and it makes sense.
It just, yeah, it seems
too simple.
I know. So here we are, trying to fix the healthcare system.
Right.
So you said something, just kind of, you were talking about the logistics companies, and so there might be some competition, like I can, name a big logistics company that, you might be competing with, but, how are you differentiating from a big logistics company like Amazon? I'll go ahead and say it. I mean, aside from just, that rural and accessing, or giving people that, might not have access to getting their medications delivered.
Yes. So we're taking an approach. So what we do is we partner with logistics companies, and then we partner with different types of logistics companies too. So coming to ScriptDrop, think of us as that one-stop shop for whenever you want your delivery. So maybe you have an antibiotic, and we're like, okay, we need to get this to you within an hour. We can do that. Maybe it's a maintenance medication. We're just going to go ahead and ship that through UPS. So us being able to have that versatility of types of delivery is really critical, as well as we are not a pharmacy ourselves. So there's Amazon, of course, is a digital pharmacy, and there's a lot of those other digital type or cloud pharmacies, as people say, out there. And we take the approach, we're not a pharmacy, but we partner with pharmacies. And so it's that power of brick and mortar that still exists. Those physical points of presence, it's how we get the medications to the patients then even faster. Is because you still need to work with a dispensing pharmacy to pick up and then deliver the medication to the patient. So the power of our network actually helps a lot of our pharmacy partners band together against Amazon and give them a way to offer delivery faster and offer differentiated delivery, something that a patient can get in an hour instead of having to wait for it to be shipped.
Yeah, no, that's great. And then, it also, brings upon, the important part of, the pharmacist. So, I used to work in a pharmacy, so I know the relationships that patients have with their pharmacist. A lot of times they'll see their pharmacist before they'll see their doctor, right? It's just that local person that they can, talk to, they have this really good rapport with. And so, are you able to help pharmacists maintain these types of relationships?
Exactly. I mean, pharmacists are some of the most trusted in all of the professions out there. I think it's the number two, actually. So yes, we believe that pharmacists are critical in healthcare and the healthcare ecosystem and the workflow, and allowing folks to have connections with their pharmacist that already exists. And when you think of a lot of the population still with baby boomers, they still probably want to talk to their pharmacist and care about their pharmacist. And so our network and our power allows us, if you love your pharmacy, keep it. That's fine. We can connect you with the pharmacist. Your pharmacist then has new offerings that they can give to you, especially if you can't get in to see them. It's okay. They can still work with you. You can still get your medication from them instead of having it have to go to one of the cloud pharmacies. So we give our patients that flexibility to keep their pharmacist. But if you also don't care and you're in a telehealth visit, where that script comes from, we can use anyone in our network too. So it's creating that foundation allows us to have the flexibility for our patients at the end of the day.
That's great. Let's see. I have other questions. So we've talked about telehealth and just, that extension into that so that, patients get the care that they need. Where do you see, telehealth moving forward? I know that, it was, there had been a struggle for telehealth to, come into being. And then with the pandemic, it was just like, well, thank goodness we have this. But now that, people are getting vaccinated and they can go, people are roaming more. Do we stay with telehealth? I know that some payers are, changing how they reimburse. How does this kind of grow into the future, do you think?
Yeah, I definitely think the space will consolidate. But what we're hearing also from a lot of our health system partners is it's probably going to remain about 25% of their visits. It is the new normal. And convenience is the new normal. I can see my doctor like this instead of having to actually get in the car and go somewhere, and same with prescription delivery. So they seem to go hand in hand. But I definitely don't think it's going away anytime soon. And we'll just continue to consolidate, but also find different ways to differentiate platforms for patients or for their healthcare partners or their health systems even. So I think it's an exciting space to watch and for us to be a part of.
Yeah, no, I totally agree. And, it's interesting. So I had also, worked at a digital health company, with patient follow-up. And so, as you're looking to expand, just maintaining care, with your emphasis being on patient and patient health and getting the treatment that they need, that follow-up, is the medication working? Do they need refills? Maintaining some sort of touch point with patients and that connection between, their pharmacist, their doctor.
It exactly. And the other piece too is that there are so many adherence programs out there,
Mhm.
and they're all great in some way, shape, or form. But what they all could use is that power of delivery at the end of the day to know, okay, my patient got the therapy in the first place. And then how do I make sure that they actually are adherent and continue? Instead of, it just often being patient reported outcomes or looking at some data, we have, the proof that they received the medication. So yeah, just really thinking of us as that plug-in for some of those adherence programs too, but continuing to empower the pharmacist and pharmacy, of course, to stay in touch through those refill reminders, having delivery as a part of that.
Yeah, excellent. Cool. Well, those are all the questions I had. I thought, a really good conversation. Do you have any, other things that you'd like to share that I didn't touch on?
I I cannot think of anything. No, this has been great. I'm excited to be the first one.
Yeah.
So yeah, thank you so much for having me.
Yeah.
No, I thought it was great.
Yeah. I really enjoyed learning more about, about you and your company, and just really how it, kind of fits into that whole ecosystem. And, like, the our members, I think I hope they know that, like when I look at companies and evaluate them, these are the types of things that I'm looking at, like the management, the fit, it's not just the financials. And, like, I really like, the values that you've set forth, and just, how it integrates into the whole healthcare ecosystem, to really, not differentiate it, but just, improve it. So I really like that.
Thank you. I appreciate it.
Yeah, cool. All right. Thank you so much, Amanda.
Thank you. Great.